Hello and welcome everyone. Today I am here with you to discuss the popliteal fossa. Dear medical students, please follow the illustrations for better understanding. Now, what is popliteal fossa? Popliteal fossa is a diamond-shaped intermuscular space or region at the back of the knee joint. Popliteal fossa is a passageway for several important neurovascular structures and has both gross and clinical significance. Because it is an intermuscular space, principally bounded by muscles apart from fibrous structures. Just now, I have mentioned that it's a diamond-shaped area, so it has four boundaries. They are superomedial, superolateral, inferomedial and inferolateral. What structures form the boundaries of the popliteal fossa? Superomedially, it is bounded by two muscles. They are semitendinosus and semimembranosus. Superolaterally, bounded by the biceps femoris muscle. Inferomedially, it is bound by the medial head of the gastrocnemius muscle, and inferolaterally, the lateral head of the gastrocnemius muscle and plantaris muscle, which is present under cover of the lateral head of the gastrocnemius. This animated illustration shows the structures forming the boundaries of the popliteal fossa. Apart from boundaries, most of the intermuscular spaces in our body also contain roof or superficial structures, and flow or deeper structures. In general, the roof of intermuscular space is formed by skin, superficial fascia, and deep fascia. The deep fascia of the popliteal fossa is called the popliteal fascia. As we all know, the superficial fascia is made of loose connective tissue, contains fat, and allows passage for vessels, nerves, and lymphatics. These are collectively called subcutaneous vessels and nerves. Now coming to the roof of the popliteal fossa, is made of 1. Skin, 2. Superficial fascia, and 3. Deep fascia or popliteal fascia. Superficial fascia contains 1. Short saphenous vein and its tributaries. 2. 3 cutaneous nerves are posterior cutaneous nerve of thigh, medial cutaneous nerve of thigh, and peroneal communicating nerve from the common peroneal nerve. In addition, the sural nerve is a branch from the tibial nerve that may also be encountered. Next is the flow of the popliteal fossa. The flow structures are named from superior to inferior. 1. Popliteal surface of the femur. 2. Posterior part of the fibrous capsule of the knee joint. 3. Oblique popliteal ligament. 4. Popliteus muscle and its fascia, that is the fascia covering the popliteus. Dear students, the boundaries about the popliteal fossa are completed. What is next? The fossa is fully loaded with nerves, blood vessels, lymph nodes, and adipose tissue. These structures are called contents. Contents of the popliteal fossa. 1. Terminal part of posterior cutaneous nerve of thigh. 2. Tibial nerve and its branches. 3. Common peroneal nerve and its branches. 4. Popliteal vein and its tributaries. 5. Popliteal artery and its branches. 6. Popliteal group of lymph nodes and 7. Popliteal pad of fat. Minor content is the genicular branch of the obturator nerve. A notable point about the popliteal fossa. In the upper part of the fossa, the structures arranged, from medial to lateral, are popliteal artery, popliteal vein, and tibial nerve, that is AVN. In the middle of the fossa, from superficial to deep is tibial nerve, popliteal vein, and popliteal artery, that is NVA. In the lower part of the popliteal fossa, from medial to lateral side, the arrangement is tibial nerve, popliteal vein, and popliteal artery, that is NVA. Gross features of the popliteal fossa are completed. Next, I am going to discuss the clinical anatomy of the popliteal fossa, which is the essential part of knowing the.
The most important thing is aneurysm among the clinical anatomy of popliteal fossa. Popliteal artery aneurysms are the most common aneurysms and accounting for 70% of all peripheral arterial aneurysms. They are more common in men with a prevalence of 95% than women. Popliteal artery aneurysms may lead to thromboembolic events and limb loss. During larger popliteal artery aneurysm repair, the femoral artery may be ligated in the adductor or Hunter's canal to reduce the blood flow. Modern surgical treatment combines arterial bypass with ligation or interposition grafting and remains the gold standard for treatment. Second one is popliteal pulse. Blood pressure in the lower limb is recorded from the popliteal artery. Third, clinical anatomy of popliteal fossa. Injury to common peroneal nerve is most common, is due to fracture of neck of fibula, which leads to motor paralysis of the peroneal and extensor compartments of leg, which results in foot drop. Fourth one is deep vein thrombosis of popliteal fossa. Deep vein thrombosis, or DVT, is a blood clot that forms in a vein deep within the body. It most commonly occurs in the legs, but it can also affect the arms, pelvis, or other parts of the body. Popliteal vein is a common site for deep vein thrombosis. Swelling, pain, and tenderness in the calf are classic signs. And the last one is Baker's cyst. Baker's cysts, also known as popliteal cysts, caused by inflammation of popliteal or semimembranosus bursa. Located in the posteromedial region of the knee between the medial belly of the gastrocnemius muscle and semimembranosus tendon. It is one of the most common disorders in the knee. These fluid-filled cysts form a lump at the back of the knee that often causes stiffness and discomfort. Dear students, I hope you've acquired popliteal fossa gross and clinical anatomy. Use the comment box for queries. Like, share, and subscribe to Indian Anatomist. Click the bell icon to get new video updates. Thank you, everyone.